Endometriosis is a chronic inflammatory disease that we find in women. By and large, it is not cancer. It occurs because the tissue that is available in the lining of the uterus, which is hormone sensitive, it swells every month and bleeds during periods, is available outside the uterus as well. So in that place also it grows and bleeds, but it has no place to come out. So it starts collecting, and then it also causes a lot of adhesion so that things and the organs around the uterus and ovaries get stuck together, which can lead to pain and problem of fertility. We find endometriosis in young adolescent girls as well. So whenever there is a pain during periods in young girls also, which is intractable, that means they are not able to go to school or do their day-to-day activity, it could be because of endometriosis. So it is a myth that young girls cannot have endometriosis. Partly yes, because part of the endometriosis can be involving the uterus itself, which we call adenomyosis. So if you have only adenomyosis, removing the uterus will solve your problem. But if this endometriosis is spread to your ovaries, it has got the motion passage or the bowel stuck, or it has other lesions inside the pelvis, all those need to be addressed properly for you to get complete relief. So only removing uterus may not help you. Well, this is a myth. Using tampons, we have no scientific evidence that using tampons can increase endometriosis, or involving yourself in sexual activity will increase endometriosis. So that's a myth according to me. Partly myth, because if you have a genetic predilection, then you are destined to become or develop endometriosis in your lifetime. But we can give you some medications to halt the progress of this problem. And the simplest medication that you can take is contraceptive pills. But we can only halt the progress, and if we can diagnose it early. So again, to young girls, if you have intractable period pain, don't take it on face value that it will improve once I get married or once I have children. That pain needs to be evaluated and diagnosed or clarified whether we have endometriosis or not. True. So 30% of patients who are infertile can have endometriosis. So endometriosis is one of the important cause in women which will make them infertile. Then again, it will depend upon whether the patient has what stage of endometriosis, whether we should do a surgery for her to improve her fertility or advise her to go for IVF and say infertility treatment for her to get pregnant. But most patients with infertility may require some help in getting pregnant. Two common reasons women come to us with endometriosis: pain and fertility. Pain, by and large, can be treated by some medication to suppress the periods in these women. So if you can make them period free, their pain goes away. But it doesn't control the disease inside. The disease inside can be excised and removed by doing surgery. And this surgery today can be done by minimal access surgery like laparoscopy or robotic surgery, which is an advanced form of laparoscopic surgery. But remember, after having the surgery, you may require some suppressive therapy. So remain in follow-up of your doctor so that they can give you the suppressive therapy so that recurrence is less.